The honourable member Cumberland Colchester.
Well, thank you very much, Madam Speaker. It's a pleasure to rise and talk about Budget 2024. It's interesting, you know, what we often hear from our colleagues across the aisle is, who made this mess? Whose fault is all of this? What is the problem here? When we figure out who did all this, there is going to be big trouble. And we know clearly that after 9 years of this NDP-Liberal coalition, that it's their fault. They're the ones who did this. And it often reminds me, you know, I have 3 children. They're grown now, and 2 grandchildren. But when my children were growing up, there was a kids show, and maybe this is where they get their ideas. It was called The Big Comfy Couch, and the female character on there would say, "Who made this big mess?" and look around and wonder who did it. And of course, we all know who made the big mess. That show went on to have a 10-second tidy, and maybe that's what they're trying to do here, Madam Speaker, is to tidy up their mess, because on that TV show, of course, what they did is stuff things under the couch cushions, etc., and everybody knew the mess was still there. And I think that's where we are, Madam Speaker. On behalf of Canadians, the Canadians know who made the mess, and Canadians know that there's still a mess, even though they've just hidden things here and there. Canadians know that the debt is now over $1.2 trillion, and that's a number that's even hard to understand for most of us. What is $1 trillion? What does it look like? And one of my great colleagues from Peace River, Northern Rockies, made a fantastic video. I'd encourage everyone in the House to have a look at it, to put it in perspective. You know, what's $100,000? What's $1 million? What's $1 billion? What does it look like? And what's $1 trillion? And what's the difference? Perhaps it's easier, Madam Speaker, to understand that the debt on a per Canadian basis is almost $31,000 per Canadian. We've heard this multiple times this morning from many of the eloquent speeches that have been given here, but we know that the cost to service the debt now is $54 billion. And I said this morning on a radio show, that of course that's more than $1 billion a week. And you know, people often think that you're saying it's 54 million with an M, but no, it's B as in billion with a B, bravo. That's more than we spend as the federal government in Canada Health transfers to the province to attempt to pay for health care, but we'll talk about that more. This budget talks about another $40 billion with a B in new spending in a government that has its foot firmly on the gas pedal of the inflationary fire. Continuing to spend is costing Canadians. And when we look at it, there's problems here that they refuse to address. The Prime Minister stood in this House and talked about 7,500 new doctors, nurses, and nurse practitioners in the Sunny Ways budgets of days gone by. We now know that more than 7 million, almost 7 million Canadians do not have access to primary care. We know that wait times are the worst that they've ever been in the last 30 years. In 2015, the average wait time from seeing a family doctor to specialist care was 18.3 weeks. 2015, a milestone year, I might add. 2017, that went up to 21.2 weeks. 2019, 22.6 weeks. 2022, 27.4 weeks. That's more than half a year. And as I said previously, that is the worst wait times the Canadians have seen in the last 30 years. People have died on waiting lists in Canada, and in spite of the fact that my Liberal colleagues do not want to believe facts, which I'm not surprised by, last year, 17,000, and not all provinces reported these numbers, Madam Speaker, 17,000 Canadians died while they were waiting for a procedure or a diagnostic test. Now, if you extrapolate that, Madam Speaker, one would understand that that could be more than 30,000 Canadians who died waiting for a procedure or a diagnostic test in this country. The numbers don't get any better, Madam Speaker. Gynecological surgery numbers, the acceptable wait time is 9.9 weeks. In 2015, it was 16 weeks waiting. In 2022, it has doubled to 32.1 weeks. Wait times for neurosurgery in 2015, 27.6 weeks. In 2022, 58.9 weeks. ER wait times in 2013, 2.5 hours. In 2021-22, a minimum of 4 hours. We also know, Madam Speaker, that many people have suffered waiting in emergency rooms, and certainly I know that my colleagues on this side, we hear from people who support us. We hear from them almost every day in person, by email, by phone call, that they are fed up with the system that we have, and it is not working for them, yet this government continues to spend on other priorities. They talk about pharmacare. What they've announced, much to the joy, I'm sure, of their NDP masters, is they've announced a completed house when they have yet to even consult an architect. People are presenting themselves to pharmacies and saying, I'm here for my free medications. And of course, what we know is that this government, this NDP-Liberal government, will create a new agency at the cost of $90 million and over $30 million a year, and do a consultative process. And sometime down the road, there could possibly be a plan which we know is inferior to the plans that exist at the current time. Our NDP colleagues often are wanting to say, well, tell us about the coverage that this wonderful plan will have. Well, we know that even with the supposed formulary that has been announced, that it actually covers less than half of the insulins that a place like BC already does cover. And of course, as my Bloc colleagues know very well, that healthcare is within the provincial jurisdiction, not that of the federal government. When we look very clearly, again, about another program that they have taken multiple attempts to, with their photo ops to announce how great it is, their dental care program. The Ontario Dental Association has made it clear to Canadians with multiple ads now, warning Canadians that no, this is not another free program as announced by the NDP-Liberal coalition. The Canadians will be responsible for 40 to 60% of costs out of their own pockets. Certainly we know that there are many newspapers out there who have said that this program is toothless. Shocking from a government who tried to roll out a program in 6 months that should have taken 7 years. So when we look at this, Canadians are being misled by this government, Madam Speaker, and not understanding that this program will cost them out of pockets. We're also very well aware from multiple consultations with provincial dental associations that dentists are refusing to sign up for this program because of the significant administrative burden that this government has attached to it. Sadly, Madam Speaker, we know that 2 million Canadians are going to food banks every month. 2 million Canadians. We know that the cost for housing has doubled. In spite of the billions of dollars announced, no houses have been built by this federal NDP-Liberal coalition. We know that higher taxes and more inflationary spending is driving up the cost of everything. And we also know that the former Liberal governor of the Bank of Canada, David Dodge, says that this is the worst budget in 40 years. And again, as many of my colleagues point out, I think it goes without saying who was in power in 1982. We know very clearly that there are options out there for Canadians, and we know that they need to make their voices heard, which they do to us on this side of the House every single day. We know that Canadians are dissatisfied. We know that they are hurting. We know that they don't have enough money coming in every month to pay their bills. We know that Canadians are ready for a change, and for that, we are forever thankful for their support. Madam Speaker, it comes as no surprise that for all those reasons that I have outlined, there's absolutely no way that I could possibly support this budget, and quite happy to say that I will not support Budget 2024. Thank you, Madam Speaker.